Hello, everyone. Welcome to my weekly column, Ask the Doctor. I am Dr. Wale Okedion. I'm a medical practitioner of at 45 years standing. I'm a family physician, and I'll be taking you on a weekly question and answer session of common medical questions from my patients. For this week, I will take 8 questions. The first question is this: Dear doctor, kindly tell us the earliest signs of dementia. And the fellow who answered that question is somebody from Nigeria. I will not be mentioning names. My answer to that question is that early signs of dementia include memory problems, especially short-time difficulty with language and communication. We also have challenges with planning and problem solving. Sometimes those who have issues of dementia get lost in familiar places, and they can also have changes in mood and behavior, such as increased anxiety or withdrawal. Other signs can be visual or perceptual issues, poor judgment, and confusion about time or place. These symptoms often start quietly and can be mistaken for just normal aging. Therefore, seeking medical advice for a full assessment is important if you notice several of these signs. Dementia is like a spectrum, that is, there is often more than one type involved. We don't have all the tools to make an exact diagnosis, unfortunately, while somebody is alive, until maybe after the death. That is when we can do some research. However, important thing to know is that the dementia symptoms are as unique to the individual. While some people are extremely good at hiding the symptoms, other people cannot hide it. Therefore, any behavior that is markedly odd and inappropriate from someone's usual demeanor should be considered a symptom of dementia. The moment you notice an unusual behavior in somebody who was normally well, then you need to take that person for a full medical checkup. Thank you. That is question. Is from another person. This is a man. He said, "Dear doctor, I usually taste my urine and I find it to be very bitter. Is it normal for one's urine to taste bitter?" And my answer is that the taste of urine varies from watery to slightly bitter, or it can be sour and it can even be sugary. Normal urine is actually usually salty and could be bitter. However, a sweet tasting urine may be the first signs of diabetes. When somebody has jaundice, the urine may now start tasting bitter. However, it is well known that it is what you eat and drink, including the kind of medications you are taking, that determine the odor and flavor of urine. So unless you have genuine illness, the taste of your urine has no bearing at all upon your health. It's only a slightly useful diagnostic test when other symptoms are present. Luckily for us, modern doctors don't really rely on a test of urine. But now they are available, simple, cheap, and accurate, and very fast kits where you can use to test your urine, check your urine. Therefore, the old habit of testing your urine is obsolete. It's not necessary again. We now have simple stripped tests that we can buy from the laboratory to test your urine to know whether it's normal or not. The third question is from a 50-year-old trader. He's a male, and his complaint is that is always feeling tired. He said, "Dear doctor, I'm always feeling tired. Kindly let me know how to handle this." And my answer is that when you feel tired all the time, this can be caused by a variety of factors, both physical and mental. Some of the main reasons could include difficulty with sleeping, problem with nutrition, that is what you eat, when you have some mental health issues, maybe some depression or anxiety, or you have some medications, or you have some infections. You can also feel tired all the time due to poor lifestyle habits. That is, some people like staying long at night, whether at a party, or watching television, or watching film, or because of the kind of drink they take. Maybe they drink a lot of too much alcohol, or they take too much coffee. It doesn't make them to sleep well, and that's why they feel tired. Also, people who don't drink enough water, they get dehydrated, because dehydration is another form of tiredness. You feel tired. So what is important is to consult a medical doctor for a proper diagnosis, and to also be able to check your own lifestyle. Are there some things that you are doing wrong? Are you sleeping well? Are you eating well? Are there some drugs that you are taking too much in excess? Maybe sleeping drugs. Some people take a lot of sex stimulants so that they can perform well in bed, and not know that some of these drugs can affect them. So you need to look at your lifestyle, and then when you see a doctor, you explain to the doctor. He will now check you, take your blood pressure, check if possible your urine, to see whether your urine sugar is normal or blood sugar is normal, and he will also check some of your if it's a laboratory test for your blood, some indices in the blood, like if you have enough blood, or you have enough iron in your blood. You will do all these tests, and then you now arrive at the diagnosis, and you will be treated. My next question is from another young man who says that my 60-year-old uncle has swollen feet. Kindly advise me on how to handle this problem. So my answer is that if a 60-year-old man has swollen feet, it can be due to so many medical conditions, such as problems with the heart, kidney, or liver disease, or the blood circulation is not good enough, or he has some blood clots, maybe the blood is getting clotted, or he could have some injuries, either in the leg or in the body. And at the same time, there are some lifestyle factors, such as if the job of the uncle involves sitting for too long, or standing for too long, or he doesn't eat well, or this uncle of his is obese, that is very fat, or is taking some medications. We could also have cases of swollen feet when the person has arthritis, infection, or when there are some nutrients or vitamins in the blood, or iron deficiency, or magnesium deficiency. So this is important to know some of these causative factors. And the best thing, like I said again for the previous case, is to see a medical doctor who will now do some tests. He will carry out some tests. He will check the blood, check the blood pressure, check blood sugar level, and even check the weight of the person. And a diagnosis will be agreed upon, and then the drug to take will be given. Then the next question is from a lady. He said, why is my cholesterol level still very high, despite the fact that I don't eat much meat and eggs? I eat mostly a vegetarian diet, and my cholesterol level is still high. And my answer to this question is that your cholesterol level may be high even though you're on a vegetarian diet. It could be due to genetics, that is, maybe it runs, having high cholesterol level runs in the family. It could be a family issue, and then it could be that there's some food that vegetarians, vegetarians are those who don't eat meat, they don't eat animal protein. But even then, the kind of food they eat, some of them have what we call saturated fats. It can be found in some of the vegetarian foods, like coconut oil. So this could also be a form of it. Then for those who don't exercise well, lack of exercise can also cause high cholesterol level. Certain medications or some underlying health conditions can also lead to high cholesterol level. When you are on a vegetarian diet, that is, you don't take animal protein, but your body can also produce cholesterol. There is some level of cholesterol production in the body, and this can also make it lead to your cholesterol level to still be high. Therefore, you need to look at your diet, what you eat. You have to look at your lifestyle habits. You need to do some exercise. Ordinarily, going for walks in the morning is good enough. And if there are some medications you are taking, you could talk to your doctor. Some of these medications can also lead to high cholesterol level. Then the next question is from another lady. He said, my husband has not been eating well of late. In addition, he has been losing weight with frequent bouts of abdominal pains. Please, doctor, let me know whether this is stomach cancer. He wants to know whether the husband has stomach cancer because he's losing weight, he's having stomach ache, and he's not eating well. And my answer is that signs and symptoms of stomach cancer include abdominal pain, particularly in the upper part of the abdomen, indigestion, that is difficulty in digesting your food, feeling full after eating small meals, nausea, that is feeling of vomiting, unexplained weight loss, tiredness, and blood in the vomit, or blood when you cough out blood. You see, these symptoms can also be caused by other things. However, it is important that because your husband is already complaining of some of these symptoms which I've mentioned, it is important for your husband to see a doctor for a proper investigation. And some of this investigation will include taking some blood sample for laboratory tests. You can do some X-rays of the body. There's something they call the barium meal, where your husband has to drink a whitish solution, and then the X-ray will be taken. And that, as the whitish solution is passing through the stomach, the X-ray will show, and then later it will confirm whether there is a problem in the stomach. So these tests are very important. Then the second to the last question comes from a young man. He said, I want to know whether there is a permanent cure for pile. I have pile, that is hemorrhoids. He wants to know whether there is a permanent cure. And my answer is that piles, which the medical people call hemorrhoids, can often be treated and resolved with lifestyle changes and non-surgical procedures, though there is no universal cure to prevent them forever. In mild cases of pile, this one can clear up if you follow strict diet. You may have to reduce your sugary food. You may have to take more fiber in your food, vegetables, oranges, fruits, so that you can go to the toilet easily. And also, to avoid getting constipated, you can increase your fluid intake. Take plenty of fluid, take plenty of vegetables, like I said earlier on, take plenty of fruits, try and do some exercises, go for walks, or do some jogging, and then you should also to avoid sitting for too long on the toilet. These are for the mild cases. These ones we can clear. But more severe cases, where you have bile, where you start having blood, or where the bile is coming out of your anus, then these are more severe cases that may require medical interventions, ranging from ointments and creams. There are some ointments that you can be given to pass through your anus, or creams, or in some cases, if it's so severe, the doctor can do some operation for you. These are the severe cases of bile. My last question for this week is from another lady, and is complaining about migraine. He said, I've been having migraine on an off and on basis for months. Although the medications I'm using seem to be effective, I still want to know how to effectively manage the ailment. My answer is that to manage migraines, try resting in a dark, quiet room, using a cold or hot compress, and drinking plenty of fluids. For those of you who are not familiar with migraines are severe headaches that sometimes comes when you are in a very lightly lit environment, or there are some sounds. The headaches can be throbbing, can come to your forehead and move around your head. So to manage this, I'm saying that the person should try resting in a dark, quiet room. I can use a cold or hot compress on his forehead and drink plenty of fluids. Then he also has to have some lifestyle changes, like sleeping well, regular sleep, and taking enough water so that you will not be dehydrated, regular exercise, and you need to manage stress so that you are not always thinking or getting worried unnecessarily. This will help you to prevent your migraine. Then there are so many over-the-counter pain relievers and prediction medications that can be used, but these ones will be given to you by prescription by a doctor. We are not allowed to prescribe in public. Then other things to do is that you can also try and lie down when the attack comes. Like I said, it should be in a dark, quiet room with your eyes closed, and drink plenty of water, apply cold or hot compress to your head, and if possible, stay away from strong lights, from noise. Like you live in a noisy place, you have to avoid noise, or where they are playing too much music. And in some cases, strong smells can also trigger migraines. That is, maybe when you're in the kitchen, or you are somewhere where some things are being cooked, or even the smoke of a bush that is being burnt, or when you spray insecticide, the strong smell can affect you. So you have to stay away from all this. So this is where we're going to stop for today. Next week, we will continue with other questions, and I hope you will follow my video, and I will want to see your like signs. Thank you very much. My name again, Dr. Wale Okediro, Family Health Physician. Thank you.